A 28-year-old man presents with visual disturbances. He says he has been having double vision since he woke up this morning. His medical history is insignificant except for occasional mild headaches. Patient is afebrile and his vital signs are within normal limits. Physical examination of his eyes reveals paralysis of left lateral gaze. Also, at rest, he has esotropia of the left eye. A non-contrast CT scan of the head reveals a tumor impinging on one of his cranial nerves. So which of the following nerve is most likely affected? Options: optic nerve, trochlear nerve, trigeminal nerve, oculomotor nerve, and abducens. Esotropia means medial deviation. Okay, if you look at your left eye and it's medially deviated and it's not going towards the left side, right? That is called the left lateral gaze paralysis. That means the lateral rectus of the left eye is affected. Lateral rectus is supplied by abducens. Ipsilateral abducens nerve palsy is what this patient is most likely having. And so patient would not be able to move the eye laterally, causing medial deviation of the eyes. Esotropia is also called medial strabismus. It can also cause diplopia because one eye is looking right, left. I mean, it can move fine, but the other eye is not able to move towards the left side. So that's what leads to diplopia in these patients. The innervations of your extraocular muscles, they are mainly by three cranial nerves. We have oculomotor, we have trochlear, and we have abducens. Oculomotor mainly supplies everything. So you don't need to remember what everything is supplied by oculomotor. Just remember what is supplied by trochlear and abducens. So if you remember the mnemonic SO4 LR6, SO4 means superior oblique 4. 4 stands for the cranial nerve, so superior oblique, trochlear nerve, and lateral rectus 6, LR6. That is your abducens. Also, your oculomotor carries parasympathetic fibers to the eyes, right? Parasympathetic is going to cause meiosis, constriction of the pupil. That is done by your oculomotor. Also, it can also elevate your palpebral muscle. So the posterior palpebrae superioris is also supplied by your oculomotor nerve. So nothing is seen in this patient. It's usually just the left lateral gaze, and esotropia is what we need to remember, and that's why the abducens nerve is the answer. We ruled out oculomotor already, right? If you have lesion in the oculomotor nerve, none of your muscles are going to work. You're going to have ptosis because your levator palpebrae superioris is not being innervated. You're going to have a little bit of dilated pupil because parasympathetic fibers may be, if they are affected, then they can be, the sympathetic is going to take over, causing dilation of the pupil. None of the other muscles, extraocular muscles, are going to work. Only your SO4 and LR6 are going to work, right? Superior rectus and superior oblique and lateral rectus is going to pull your eye down and out. And you will see that that is the term that they use in oculomotor nerve palsies, down and out eye. Okay. Next is trigeminal nerve. Trigeminal doesn't innervate any of your extraocular muscle. It provides sensation to the face, and also it supplies mastication muscles, that too through only the mandibular branch. That is the only branch that carries the motor supply. Next is trochlear. We already mentioned about that. That is the superior oblique muscle. If you have lesion in superior oblique or trochlear, people will not be able to read and will not be able to go downstairs. Because remember, it's superior oblique. Again, if you watch YouTube videos, that's how I remember it. It's a bit weird that it kind of elevates you. It kind of, even if the name is superior oblique, it doesn't mean that your eyes are going to go up. It's going to pull towards the downside. Okay, and that's why that's the lesion. And last is the optic nerve. As you know, it doesn't have any motor supply. It only for sensation. It's going to carry the vision to your brain, that is the occipital lobe, and it's going to interpret, right? That's the optic pathway. And if optic nerve is involved, it's going to lead to blindness, but nothing wrong with your extraocular muscles, basically.
Thanks for watching. Please give a thumbs up and subscribe for more.